The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. The show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join. Hit me.
Welcome to the Senior Rehab Podcast.
The podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello friends, this is Dustin Jones. This week's short comes from Kathy Shirley. She is a physical therapist and a professor down at Texas Women's University. I really admire Kathy. She's been so encouraging to me and many others, online and in person. She's pretty active in the Facebook group, and she is a patron as well of the Senior Rehab Project. So I really appreciate her perspective. But she sent me an email a week or two ago. I've been highly encouraging her to start her own blog, Kathy, and I'm going to do everything I can to make that happen. But she sent this to me, and I wanted her to read it because it really hit home for me, and I know it'll hit home for many of you that are in this area of geriatrics, but are very uncomfortable or lack the skills to be treating patients that have vestibular issues. And I shouldn't say you lack the skills. You have the skills to do it. We just need to put more emphasis on it and really value the skill set that we do have as physical therapists to make a huge impact in these patients' lives. And I'm speaking to you, but I'm speaking to myself as well. You know, I do not have a strong background and have not, refined my skills in this area as I should. So, Kathy, thank you for the proverbial kick in the pants, if you will. But I'll stop rambling. Here's Kathy Shirley with why you should step up your vestibular game.
Since moving into full-time academic faculty position, I work one morning a week in an outpatient orthopedic and sports PT facility. This past week, I was referred a patient by one of the orthopedic PTs due to complaints of intermittent dizziness that she picked up during a thorough assessment for this patient's primary referral of low back pain. This individual had been dealing with symptoms of vertigo with position change for 20 years. There is nothing more frustrating or gratifying to me than to see this type of patient scenario. Over 20 years, she had seen numerous physicians, recovered from cancer, had a total joint replacement, and been to physical therapy several times. Her history was clear-cut, classic posterior canal benign positional vertigo. She had an overseas trip planned in a week. I treated her that day with 3 consecutive canalith repositioning maneuvers. Due to her trip, I had her return in 2 days to confirm that her symptoms were resolved. Symptoms of severe vertigo and nausea that she had lived with for over 20 years were no longer present. Her response to me was, "I am amazed, and now I can really live my life." She had bought into the idea that this was a part of getting old, that you just have to live with it. No one told her there was treatment available until she came to me. The PTs I work with are trained to look for dizziness and know I am available. This individual will need follow-up balance training due to secondary compensatory strategies that she's been forced to rely on. Her fall risk is now decreased. We have the highest levels of research supporting the use of canalith repositioning maneuvers in the treatment of BPPV. Yet the number of physical therapists that feel comfortable doing this treatment remains small. This is a diagnosis that transcends all specialty areas and patient care environments. I wish we had the same interest in learning to assess vestibular dysfunction as we have in learning to do dry needling. The incidence of BPPV rises with increasing age. Every physical therapist, and especially every geriatric physical therapist, needs to know how to recognize benign positional vertigo. They ideally need to know how to treat it, and if not willing to treat, they need to refer out immediately. There are no viable excuses that can explain why this patient dealt with this easily treated diagnosis of BPPV for 20 years.
Thank you, Kathy, for your perspective and taking the time to read that bit. But for the listeners, check out the show notes because Kathy sent over some links to some different courses and educational resources found online that will be helpful for you to step up your vestibular game. Once again, thank you, Kathy. I appreciate you, and I appreciate you, the listener, for taking the time. See you. Hit me. Thank you for listening to the Senior Rehab Podcast. I appreciate your time, and if you enjoyed this episode, do me one favor. Share it with one other person that would benefit. Thank you. If you want to see the show notes or find more episodes, just go to seniorrehabproject.com. And until next time, my friends, do not forget to stay funky. The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. This show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join.